Hello, my name is Shanice Dent, and today I'll be presenting on disciplinary feedback systems and applied behavior analysis. So, performance feedback is one of the most powerful tools we have in both organizational behavior management and applied behavior analysis. I decided to focus on this because, as a clinical director, I support up to 15 BCBAs in my region. And one of the biggest deficits I see is just struggles with delivering disciplinary feedback to RBTs, constructive feedback, corrective feedback, whatever that looks like. So, a lot of times, the feedback that is given during session is obviously clinical. They do very well with like giving positive feedback and even sometimes, corrective or constructive feedback when it's related to, clinical barriers. But when it comes to other things like tardiness or professionalism or professional dress or other things that need to be addressed outside of the clinical aspect of it, BCBAs tend to struggle. So I decided to focus on this because I think it is an area for improvement for BCBAs. Performance feedback in general provides clear data driven information about staff performance and it enables timely behavior change. Effective feedback supports treatment fidelity and it directly impacts the client outcome. So when we don't give corrective feedback or disciplinary feedback as appropriate, this then has a negative impact on the client. So, for example, if an RBT is consistently late, right, this doesn't just impact the organization, but the client is now missing out on, minutes or hours or whatever of services because that professional deficit hasn't been addressed. So, feedback is not just communication, it's a behavioral intervention itself. So it's important to distinguish between corrective and disciplinary feedback. Sometimes I catch myself using these terms interchangeably, but for the sake of this study, it is important to differentiate between the two. Corrective feedback focuses on shaping or improving a skill through immediate constructive guidance, whereas disciplinary feedback emphasizes accountability. It addresses professional standards, ethical explanations, or persistent performance issues. So these are typically, they can be delivered separately, they can be delivered together, it just depends on the situation. Both are very important, but many supervisors are more comfortable giving corrective feedback and tend to avoid disciplinary conversations, which then hinders consistency and quality of care. Despite the BACB's emphasis on supervision competencies, research by Sellers et al. 2016 supports that BCBAs often lack structured training in supervisory feedback delivery systems. This creates a gap where supervisors may hesitate to address performance issues directly, which then leads to reduced accountability and inconsistent supervision. So I think accountability is very important here. BCBAs sometimes shy away from having those conversations because they may not want to look like the bad guy or they don't want to, hinder that relationship between them and the RPT. But just refocusing on the goal, which is positive client outcomes, this then kind of drives that motivation for having these hard conversations and often delivering the disciplinary feedback as appropriate. Over time, the avoidance behavior can become reinforced, so BCBAs may escape the discomfort of confrontation, but the organization then suffers through lower fidelity and poor outcomes for the clients. Research supports that effective performance feedback is important. Conning et al. In 2005 and 2008 found that immediate feedback improved treatment integrity among staff implementing behavior support plans. Brown et al. 2013 also demonstrated that combining feedback with goal setting and behavioral observation skills led to better skills retention and transfer. Despite this research, we still see challenges like observer reactivity and ecological validity when feedback systems are implemented inconsistently. Behavior skills training, or BST, is a structured evidence-based approach to teaching new behaviors through 4 components: instruction, modeling, rehearsal, and feedback. BST has been used effectively across many domains to teach complex skills. When applied to supervision, BST gives BCBAs a systematic strategy for learning and practicing how to deliver corrective and disciplinary feedback consistently and professionally. Several studies demonstrate BST's effectiveness in supervisory context. Research found that BST successfully increased goal-setting behaviors, Cruz et al. 2023 showed that BST improved both supervisory skills and RBT fidelity in DTT. Sawyer 2025 found that adding coaching to BST further enhanced skill retention in pre-service teachers. These studies confirm that BST leads to lasting behavioral change, but its application to disciplinary feedback remains largely unstudied, creating a clear gap in research. Other emerging supervisory strategies include video self-monitoring, where supervisors record and reflect on their own performance, and telehealth supervision, which can expand access but also introduce new barriers. Maguire and colleagues in 2022 emphasized performance management even during crisis situations like the pandemic. Ultimately, effective supervision, no matter the format, has been linked to improved staff performance and client outcomes. The purpose of this proposed study is to evaluate how BST can be used to improve BCBA's disciplinary feedback delivery. While performance feedback research is well established, disciplinary feedback specifically, feedback that addresses accountability, tone, and professionalism, hasn't been studied rigorously in ABA. By focusing on these components, the study aims to fill that gap and provide a model for structured, effective supervisory feedback systems. The proposed study included 5 actively practicing BCBAs who currently supervise at least 1 RBT. All participants must have completed the BACB supervision training, but have no prior formal training in disciplinary feedback delivery. The sessions will be conducted virtually using secure video conferencing. A non-concurrent multiple baseline design was used to stagger BST implementation while maintaining experimental control. The independent variable is BST, focused on feedback delivery, and the dependent variable is behavior observation scale scores, reflecting accuracy, tone, specificity, and professionalism. During the baseline phase, each BCBA conducts mock feedback sessions with the researcher, role-playing RBTs displaying various performance challenges. In the intervention phase, BST is introduced with instruction, modeling, rehearsal, and feedback. After mastery, maintenance probes are conducted at 2 and 4 weeks post-training to test retention. Integrity checks ensure consistent BST implementation, and inter-observer agreement is collected for at least 33% of sessions, with 90% agreement required for reliability. The mock results show that during baseline, all 5 BCBAs displayed low and stable behavior observation scale scores, generally between 30 and 50. This data indicate that prior to BST, their disciplinary feedback lacked accuracy, specificity, or professional tone. When the BST intervention was introduced, we saw an immediate and substantial improvement across all participants. Each BCBA scores increased sharply into the 80 to 95 range, reflecting rapid acquisition of feedback delivery skills once structured instruction, modeling, rehearsal, and feedback were implemented. Most importantly, these improvements were consistent across all participants, and the staggered introduction of BST across different time points helped to demonstrate instructional control. This pattern indicates a strong functional relationship between BST intervention and improved supervisory feedback performance. In the maintenance phase, which occurred 2 and 4 weeks post-training, scores showed slight decreases but remained well above baseline, suggesting that the skills generalized and were maintained over time without traditional supports. Overall, these results support BST as an effective method for training BCBAs to deliver high-quality disciplinary feedback that aligns with professional and ethical standards. These findings are anticipated to extend the literature on supervision and OBM by directly applying BST to disciplinary feedback system. This is a topic that is rarely studied in ABA. By improving feedback delivery systems, this can close the supervision gap identified by Sellers and colleagues in 2016 and enhance RBT performance overall. Better supervision leads to higher treatment fidelity, which ultimately produces better client outcomes. This study emphasizes that feedback is not just managerial, it's a behavioral intervention that sustains organizational excellence. As with any study, there were some limitations to this proposed study. Because the study uses role play, ecological validity could be limited. Participants may perform differently in a real clinical setting, especially since myself as the primary investigator would be the one role-playing the RBT. Observer reactivity can influence feedback quality, and small sample size limits generalization. So it was a smaller sample size, so this may impact generalization probes. Future research could examine disciplinary feedback in real-world supervisory contexts, evaluate long-term maintenance, and explore broader organizational outcomes like retention and turnover. In summary, behavioral skills training offers a structured, evidence-based model for training BCBAs to deliver disciplinary feedback effectively. When supervision is clear, consistent, and reinforced, it improves both staff performance and client performance. Integrating disciplinary feedback training into BACB curricula could help standardize supervision practices across the field. Ultimately, this research highlights how strengthening supervision practices strengthens the entire service delivery system, enhancing accountability, professionalism, and quality of care. And these are my references. Thank you so much for watching my presentation.